Happy holidays from Core Medical. I'm Cyndi Peschong, nurse practitioner with the Core Medical in the Littleton location in Colorado. Just wanted to talk to everybody about the viruses going around this season because it is cold outside and winter brings three nasty little viruses all to the front. The first one being RSV, respiratory syncytial virus. It is definitely worse in the winter. It is definitely worse for infants and for the elderly. They have immune deficiencies. Okay, they're older, they have health issues and health diseases and medications that decrease their immune system, and the little ones just haven't been around long enough to build up their immune systems yet. It's definitely worse in kids under 5, just so you know. So adults, you can get it. It looks just like a cold. It has lots of clear, ruddy nose. Their face looks very, very, very wet. And someone's just blowing and blowing and blowing your nose. It does have a cough. Some of these little guys, they get bronchiolitis or they get pneumonia because the mucus is getting stuck in these tubes that are already very tiny and small, and then they have breathing issues, and that's probably why they wind up in the hospital, because their oxygen saturations just decrease from there. Anyways, right now, the numbers are huge for RSV, guys. 77 to 80% of children in the hospital, these are children's hospitals I'm talking about, that is RSV. There is no immunization for RSV currently. They are working on one, but yeah, right now there is not one, and there hasn't been one. So just so you know, other things going around right now, the flu, okay, influenza A and B. There are 2 types of the flu. They are both equally horrible, but they could both be stopped by flu shot. Absolutely. So did you get your flu shot? You can avoid getting the flu by getting the flu shot. CDC is saying the flu shots right now are 50 to 60% effective. So that's not bad for this year, not at all. So anyway, so you're talking about 15 to 33 million people have the flu right now. Flu A starts very, very, very quickly, hits you like a Mack truck with the body aches, the high fever, the sore throat, the runny nose, the cough, and then they start having wheezing sometimes, and then sometimes the symptoms get better. Usually 4 or 5 days, you feel much better. There is treatment for the flu, guys, so you don't have to ignore it. There's a product called Tamiflu, it's been around for a long time. There's a couple other products, but they're kind of expensive. I just prefer using Tamiflu for 5 days. There's Flu B. Flu B looks just like Flu A, except for it's kind of a, what I call slow to ramp up. So all your symptoms kind of slowly emerge, and then they feel terrible, and they get tested, and it's positive for Flu B. So especially college kids, I've been seeing lots of college kids with positive flus lately, guys. So please, please, please get your flu shots, especially if you are around large populations of people, such as colleges. Then we really want to see you get your flu shot, okay? The other thing is still around, COVID-19. It's not going anywhere. It is just changing. We still have Omicron BA.4, BA.5, which now the new boosters, the Pfizer and Moderna both cover for the BA.4 and BA.5, which is the brand new booster. We do give that here in Littleton. We also give it in Broomfield. We also give it in Monroe. So it's very easy to get the boosters. The new guidelines are 2 months from your last booster or 3 months from having COVID. So all this stuff, why? Everybody keeps asking me, why are we seeing so much of it now? The reasoning is what they believe is causing this is the higher this year because of the lifting of the COVID precautions. Remember back when we used to wash our hands all the time, sanitize all the time, wipe down our cereal boxes, wear a mask indoors, outdoors, and everywhere else. Stay 6 feet apart from people. Now all of this has been lifted. Everybody's back to work. Everybody's back to school. The children are back in school, and they're starting to bring home the viruses. Absolutely. So that is why you're seeing this huge increase in viruses being RSV, flu, and COVID. The funny thing is, it's really hard to tell the difference between the 3 of them unless you specifically test for them. So just so you know, it is really difficult. You can call me on the phone, and I probably wouldn't be able to pick apart which one it was without a test. So please be safe. Wash your hands. Use sanitizer if you're going to be around other ones. If your kids are home and they're sick, keep them home because that's where they belong when they're sick. If your kids have a fever, keep them home. They don't belong in school. So absolutely. And please get your flu shot, get your COVID booster. Please, please, please. We have them free and available anytime you want them. So I'm Cyndi Peschong with Core Medical here in Littleton, Colorado. Happy holidays. Be safe and be well.